the Evolving Past Alzheimer's podcast, where we are focused on bringing you information to help prevent and reverse brain diseases like Alzheimer's and other dementias. I'm Dr. Nate Bergman, a functional medicine physician in Cleveland, Ohio, and your host on this journey. So, whether you're a baby boomer who's worried that your brain wiring just isn't working like it once was, or you have loved ones with the disease, or you yourself have already been diagnosed and are wondering, what do I do now? You'll want to listen to this podcast. Each episode, we introduce you to the top doers and thinkers that are revisioning Alzheimer's and dementia. If you have questions or comments or just want to connect, please check us out on our Facebook page, or if you're old-fashioned like me, Google Evolving Past Alzheimer's Podcast, and you'll find us that way. So here we go. Let's get better. Welcome back to the show. Today we're honored to have Dr. Mark Hyman. Mark is a world-renowned proponent and leader of the functional medicine movement. He's director of Cleveland Clinic Center for Functional Medicine, founder and medical director of the Ultra Wellness Center in the Berkshire Mountains in Massachusetts, as well as being a multiple New York Times bestselling author. And he is an all-around great guy and one of my earliest teachers and mentors in my journey to becoming a physician. Please welcome to the show, Dr. Mark Hyman. Thanks for being here, Mark.
Thanks for having me, Nate.
Mark, we all know you have a jet-setting schedule, and I really do appreciate you making the time. And, you're sort of a master, and I've learned a lot from you about making complicated things simple and practical for people. First of all, you're sort of by default, have become the worldwide spokesperson for functional medicine, and probably most of our listeners know what that is, but can you just briefly give us the thumbnail on what functional medicine is, and how is a functional medicine approach fundamentally different than like what you'd get from a standard medical approach, certainly in neurology, geriatrics, internal medicine, family medicine? How is it different?
Well, functional medicine is quite different than the way we were both trained, Nate. We both were trained to diagnose diseases based on the symptoms and based on geography. You have a headache, head pain, that's called a headache, you see the neurologist. You have a stomach ache, you go to the stomach doctor, it's a stomach problem. You have a joint problem, you go to the joint doctor. You have a skin problem, you go to the skin doctor. But the problem with your joint or skin problem might be caused by something in your gut, and they don't ask you about that. Even a heart attack could be caused by what's going on in your gut. So functional medicine is a model of thinking that addresses the body as a system. We treat the system, not the symptoms. We treat also the causes, not the symptoms. So it's medicine by cause, not by symptom. And it's not by geography, because you have a skin problem doesn't mean we just slather stuff on your skin. We go, why? And I think that's fundamentally the difference. We were trained to get to what disease, but we never really asked why. You have rheumatoid arthritis, you meet these 5 criteria, you have these abnormal lab tests, you have these abnormal examination, you have these symptoms, you have rheumatoid arthritis. That doesn't tell you what's wrong with you, it just tells you the name of the disease. It doesn't tell you the cause. So functional medicine is really a model that helps us think through the root cause of disease. And it also is not just about disease, it's about health. So when you go to the doctor, you say, listen, doc, I want to be really healthy. I want to live to be 100. What do you got for me? And they're like, well, I don't know, take a statin, eat good, exercise, don't smoke. But there's much more to it than that. And it's really about how do we create optimal functioning, hence the name functional medicine, within a patient in all the basic fundamental systems of the body. So the body's not organized in 155,000 diseases like our current diagnostic manual. It's organized based on fundamental systems in the body that are all dynamically interconnected. It's like a web. And it's really a very powerful model of thinking through complex diseases to get to the root cause.
Root cause medicine, absolutely. And when you apply that to Alzheimer's, I know you've seen thousands of people over the last couple decades using this functional medicine approach, but you've seen people with brain fog and cognitive problems, but you've probably seen a few people that have already either gotten a diagnosis of Alzheimer's, or were told they had early Alzheimer's, or were told they had something like pre-Alzheimer's, like we call mild cognitive impairment, or even just people that have a strong genetic risk, like my mom had Alzheimer's and she got it when she was 75, or my dad, or both my parents, or, where multiple people, or they know by gene testing, like in ApoE4, they have a high-risk gene to get Alzheimer's, and we're seeing this happening earlier and earlier in people. I know you've seen a number of people like this. Can you maybe share one or two stories of people that you've treated and sort of begin to shed light on the approach that you use, a sort of functional medicine approach to cognitive impairment Alzheimer's?
Well, the beauty of functional medicine is that if you treat the root causes and the imbalances in the body and optimize health, you can treat anything. Now, some things obviously respond better than others, and if you have cancer, it's not the first thing I would do, but it's also important to optimize the soil. And when you do that, the body has an amazing way to sort of reset. And I'll just give you a case of a guy who came in, was diagnosed with Alzheimer's, couldn't run his company anymore, was sort of sitting at home, pretty depressed and not functioning. And when we did a full evaluation, which we do in functional medicine, we found a number of things that potentially contribute to his dementia. One was he was very insulin resistant, pre-diabetic, which creates type 3 diabetes in the brain, as they call Alzheimer's. He had terrible gut issues for 30 years, and he had bloating and gas and diarrhea, and it was just a mess. And we know now that, gut inflammation can cause brain inflammation, which is what Alzheimer's is. He had a severely elevated homocysteine, which is a sign of B vitamin deficiency that is quite linked to Alzheimer's. If you have a high level over 14, you have double the risk of Alzheimer's. And he lived in Pittsburgh. It was an important piece of history that led me to believe that he was exposed to mercury, because in Pittsburgh, they use coal ash to coat the streets in the winter instead of salt. They use it on agricultural lands, and it's also where there are all these huge steel plants and have been. And almost everybody I see from Pittsburgh has mercury toxicity. And he had incredible high levels of mercury. I mean, we do challenge testing on people, and we think it's high if it's over 20, 30. His was 350.
Wow.
And he had a mouthful of fillings. And I essentially designed a program that addressed all these factors. We addressed his prediabetes. We addressed his methylation, B vitamins. We addressed the heavy metals. We addressed all these factors systematically. And it was fairly aggressive with him. I don't recommend this for everybody, but he had all of his amalgams removed. He had intravenous chelation for metals. And it was like the Rip Van Winkle. He came awake, and he was able to go back to work. He was able to function. And he wasn't perfect, but I don't think he would really classify it as full-on dementia anymore. And so I see these cases, and it just made me realize that treating the brain is actually not about treating the brain. It's about treating the system and the body. And when you do that, the brain responds. It's connected to everything else. There's no mind-body. There's just one organism. It's all connected. And if you often treat the body, you can fix the brain.
So that's amazing. It's an amazing story. You've told me other stories of other people that had similar, and we've also heard of other people getting similar results, which is just astonishing, especially with Alzheimer's, because it's just fundamentally, it's not supposed to get better.
No.
So even if you saw one person, it's amazing.
Yeah, if you see one person, it's a medical miracle. But if you've seen dozens, like I have, it's pretty routine. But the key is to find out what the cause is, because the truth is there's no such thing as Alzheimer's, right? There's Alzheimer's multiple, like plural. And I think...
Or like it's a syndrome.
It's a syndrome, right? It's a syndrome like irritable bowel syndrome, right? Or PMS. But it's actually caused by many different factors. And functional medicine is the only model that allows you to navigate to the factors. So they'll check a few blood tests when you go to the doctor. They'll check thyroid. They'll check B12. They'll check a few things, but mostly they don't. And they just say, okay, well, get your affairs in order. Take Aricept, which doesn't work. And, the problem was we've spent billions and billions of dollars on over 400 studies looking at Alzheimer's, and 99.6% of them don't work. And the ones that work is pathetic. It's essentially like preventing someone from going to a nursing home and delaying that by 3 months, which isn't a really big win. Mm-hmm. And yet you and I both know that, treating these patients aggressively using functional medicine, you see profound changes. Sometimes people get back to normal. Sometimes they just improve and can function and are stable. But it's pretty fantastic, the model that we have, because it allows us to navigate to all the different types. Dr. Dale Bredesen talks about the 5 types of Alzheimer's. And the end result is the same. When you look on the microscope, right? The body has only so many ways of responding to insults. But with his approach, we can actually start to sift through. Is it because you don't have enough things supporting the brain, like nutrients and hormones? Is it because you have prediabetes? Is it because you're exposed to mold or Lyme are exposed to toxins. There's all these different varieties, and you can't treat them all the same.
Absolutely. So you mentioned blood testing, Mark, and one of the things I know you and I and many, many other people for many years now have been advocating for is food is medicine. I mean, it's thousands of years old, this concept. And one of the foods that seems to be helpful, you can call it a food, you can call it a medical food, is coconut oil or medium chain triglycerides, MCT oil, for brain health and for other things. But in the context of this discussion, we're talking about treatment for cognitive impairment.
Yeah.
There have definitely been, I've definitely seen, I know you've seen people just help people kind of over and over, not just with brain issues, but other things as well. And there's been a lot written about it. But, there may be a darker side to this. And I know people have raised concerns. And I know that a lot of these concerns have been sort of directed to you after you wrote your latest book, Get Fat, Get Thin, where, can there be too much? What about cholesterol? Can you sort of speak to the is there a dark side to this? Can somebody have too much? And what do we need to be looking at? Are there cholesterol tests that we should be doing? And what are the right ones?
Yeah, a lot of questions there.
Yeah.
Well, let's just start with, what harms the brain. And what harms the brain is sugar. It's a brain toxin. And starch is not far behind. Potatoes, grains, and, sugar of any kind. And we know now that there are a number of trials that have shown that MCT oil, which is basically a derivative of coconut oil, it's a saturated fat, creates ketone bodies and can be powerful in addition to receiving the benefits of these ketones. And they can have an impact on their cognitive function. In fact, I just was reading an article yesterday about a guy who climbed Mount Everest many times using oxygen. And he was a guide, but he never could do it without oxygen. So he switched from a very high sugar diet, which he'd been using to pump up his energy, to a ketogenic diet and was able to climb Mount Everest without any oxygen, which is pretty unusual and dramatic.
Wow.
Yeah. So the ketogenic diets are very good for the brain, which contain a lot of mitochondria, which are basically the power cells, the power engine of the cells. And when you fuel them properly, they work better. And so ketogenic diets have been found to improve. I had a patient a while ago, probably 10 years ago, who came in and she had a whole host of things wrong with her. She was diagnosed as early dementia. She basically had a lot of similar things to the other person. She had thyroid issues, which we treated, and that really helped her, which was subclinical. She had heavy metals. She had lots of inflammation. And we basically put her on a program that brought her back 10 years and was pretty normal. And then she started to decline maybe after 6 or 7 years. And I put her on a ketogenic diet. And literally it was like she couldn't remember her son to the lights going on and being totally present. And this is a really critical strategy. And there's a fair bit of data on this actually now with people using MCT oil, using ketogenic diets for Alzheimer's. And it's something that I think needs to be done under medical supervision, and it needs to be developed in a careful way with the patient. But it's a very powerful tool therapeutically. It's also used in many things like epilepsy and brain cancer and other cognitive issues. So I think that's an advancing area of research. I think the challenge is that people think that saturated fat is bad, that our heart will be damaged by saturated fat and cause Alzheimer's and heart disease. But the data was very poor that made that connection. And now newer data is coming out that shows that actually saturated fat isn't the enemy, that it actually increases the good cholesterol, it decreases triglycerides, it helps actually with your brain. Your brain is made up of a lot of saturated fat. And if you don't have saturated fat in your diet, you might be having a problem, as well as omega-3 fats. So I think there are specific tests to tell what your issues are, but most heart disease is not caused by LDL. In a large study of 130,000 people, they found that 75% of those people who went to a hospital with a heart attack had normal LDL cholesterol, and 50% had optimal. And, I think about 20% had actually super ideal, and they all had problems. But only 10% had HDLs that were normal, which is the good cholesterol, which means 90% had abnormal HDL and high triglycerides, which is caused not by fat, but by sugar and starch. So we look at testing. One of them is called NMR profile, which is a way to look at the cholesterol under an MRI machine, to look at the particle size and the particle number, which is a much better reflection of your risk. And that's a test you can get from LabCorp. Quest uses Cardio IQ. They're both relatively a reliable tests to look at the way in which your cholesterol is working or not. So I saw a guy today who just had a very, very minimal, like non-detectable small particles. He had an HDL of 80. His triglycerides were, I think, 50. And he basically was on a statin, and I would ride his bike 30 miles a day, doesn't have heart disease, doesn't have high blood pressure, doesn't have type 2 diabetes. He does have a family history, but his parents both, were diabetic because they ate poorly. So I think, here's someone on Zetia and a statin for a disease which he didn't really have, and that causes mitochondrial injury and other issues. So I think we have to be much more sophisticated about our assessment of cholesterol. We can look at cholesterol absorption, cholesterol synthesis tests, and we can look at other risk factors. So I think we're very quick to give medication, but we don't really think about the long-term consequences. In fact, he was also on aspirin. And, we know there's a risk calculator for aspirin. If you have low risk and you take aspirin, you increase your risk of having a stroke or having a gastric bleed and dying. So it's not a free ride. And I think we have to be very judicious. I mean, if someone comes in, they're hypertensive, diabetic, they've had a heart attack, yeah, okay, great, give them a statin and aspirin. But if they're really super healthy and as a prevention, there's really very poor data on that.
Absolutely. So it's interesting. So you made the NMR live panel and the cardio IQ are practical things people can do to kind of follow up on the risk. And of course, the context is important. And sugar and starch and these sort of processed foods seems to be the big kind of enemy, if there's an enemy here, at least in excess. What about, so you mentioned also the guy from Pittsburgh having a high mercury level, and we know aluminum was one of the theories of kind of going back a couple decades. Aluminum was a theory on why people developed Alzheimer's, and lead is a known neurotoxin, and I've certainly seen that in people. What about the role for infections and maybe other toxins, like just things like pesticides or persistent organic pollutants? And there's more and more stuff coming out of labs at USC where they do Alzheimer's brains, and they see things like mast cells and from people that are in zip codes or in areas that have higher air pollution, with much higher rates of Alzheimer's. Have you seen that just from clinically? People that you've seen?
Well, you have to sort of follow on the history. So we know, for example, in Parkinson's disease, there's very good data that shows that, farmers have high risk of Parkinson's. It's one of the most dangerous occupations because of the pesticides, that exposure to environmental toxins in different occupations, tannery and other chloralkali plants where people are exposed to, toxins, they get very high levels of Parkinson's. Alzheimer's, the connections are a little more tenuous, but actually really, I think, important to consider, because you can check heavy metals pretty easily, but you really can't check pesticides and chemicals because they're stored in the fat tissue. So it's really hard to get them out, and it's really hard to diagnose them. You can look at urine levels and you can have idea, but it's really hard. And I think, but when we look at, other studies, when they look at body burden studies, they do, for example, Environmental Working Group did a study of babies who had their umbilical cord blood tested at birth. This is before they took their first breath. And there were 287 toxins in the umbilical cord blood before the babies even were exposed to the world. And that is frightening, especially since 1 in 6 have neurodevelopmental issues. And we know that toxins affect the brain in a very strong way, and it's a very sensitive tissue. I was just reading about epidemic of toxicity in children in China because of the amount of pollution. And it's really frightening to think we're raising a generation of poisoned children. But I think it also affects us at the other end of the spectrum of life. And I think you have to assume that people are toxic, and you just have to detoxify them.
So that's a great point in terms of detoxifying. And, I think when one person says that, they mean one thing, and maybe when another person says that, it means another thing. Can you kind of speak about general principles in detoxification? Some of these toxins can get stuck in people as fat. Have you seen anybody get worse as they kind of adopted a healthier lifestyle and maybe shed out some of these toxins?
So you have to think about it this way. You can mobilize it, but you have to get it out of your body. So if you don't, it can make you sicker, right? So if you take a laxative and you tape over your butt, you're going to get in trouble, right? So I think you have to really think about how to deal with all aspects of detoxification, which is, one, mobilizing the toxins, but also detoxifying them in the liver, making sure they get out to your liver, and making sure they get excreted out in your stool. And you need different help with all those steps. So I think, saunas are very powerful. Over time, I think the regular sweating and saunas is a great way of detoxifying. Even exercise will detoxify you. So I think there are a lot of benefits. And I think you can see how well that can work if you just do it in practice.
Yeah, definitely. Definitely seen some remarkable things so far. Well, so then there's the whole idea of, who's a good candidate, for this approach to early Alzheimer's or cognitive impairment, or are there things that people can do for prevention? Like I'm worried about because mom had it when she was 75 and now, when, probably in her late 60s, things started, and now I'm 45, I'm 50, I'm 55, and I'm, I go in the room and I can't remember what my keys are for, and I went to my doctor and he told me it's normal. But I think about mom, and I'm wondering if it's normal, what can I do? I mean, is there anything specific, or is it just like if I exercise enough and I eat enough vegetables, or is there anything specific I can do for my brain?
Yeah, there's a lot you can do. And I think the good news is this. The approach that's going to fix your brain, is going to fix your heart, is going to prevent cancer, is going to prevent diabetes. It's not like there's one diet for cancer, but it causes Alzheimer's, and a diet for Alzheimer's, it causes diabetes, and a diet for diabetes, it causes heart attacks. That's not how we're designed. Right? So what we're talking about is fundamentally starting with lifestyle, which is something everybody can do and it's cheap. And it's eating a diet that's very low glycemic, which means very low sugar and starch, potatoes, etc. It's higher in good fats, olive oil, avocados, nuts and seeds, even good saturated fats from grass-fed animals, omega-3 fats. These are all essential because your brain is made up of 60% fat and it's essential for your body's functioning. And of course, lots of colorful fruits and vegetables, 6 to 9 or more servings a day. That serving is a half a cup. And that's what we should all be eating, mostly vegetables. And a little bit of fruit, antioxidant-rich food. Berries are fine. You want to be careful not to have too much sugary fruit, I think, but mostly fruit is good. Lots of nuts and seeds and, a very rich diet in good fats, antioxidants, phytochemicals, phytonutrients, and that will really help. And there's been plenty of data showing this. There's a large trial looking at the Mediterranean diet versus a regular diet, showed dramatic improvements in brain function. I think we have good evidence there. Exercise is great evidence there because exercise increases the connections between cells, helps you build new cells, like miracle grow for the brain. It produces a compound called BDNF, or brain-derived neurotrophic factor. It has so many other benefits of detoxification, of preventing insulin resistance, of helping your lipids. I mean, it increases antioxidant enzymes. So there's a lot of benefits to exercise. Third is stress. I think we all have stress in our life. No one can get out alive without having stress. However, we can learn how to modify the stress through various strategies that we can apply. The easiest is 20 minutes of meditation a day or 20 minutes twice a day. If you learn a simple technique, there's TM, there's lots of other techniques. But that is a very powerful way to improve stem cells, to reduce inflammation in the brain, to balance your hormones, and to just feel better, less anxious and stressed. And then, of course, there's basic nutritional supplementation. And I think, MCT oil is probably a great idea for people if they really are at risk. And you can make bulletproof coffee. You can put it on salads. There's a lot of ways to use it. I think, basically a good multivitamin, fish oil, and vitamin D are foundational. And then all the B vitamins for methylation, detoxification support, depending on, what's going on with you, but you can take support through N-acetylcysteine and other things. And of course, keeping your toxic exposure low. So I would use the Environmental Working Group site to ewg.org to look at how to reduce your exposure through food, through fish, through vegetables, fruits, through meat, which all are a major source of toxins for us, as well as our household cleaning products and our skincare products, all of which contribute to our total body burden. When you put sunblock on, there's parabens in it when you do all that. And there's a lot of other ways to reduce your risk by avoiding, plastic in your life, like BPA cans, which is, again, it just contributes to total body burden. And then, if you really are concerned and you want to those are all things you can do yourself, right? And then if you're really concerned, there's ways you can work with a functional medicine doctor to dig a little deeper. What if you have a lot of mercury, but it hasn't really expressed its toxicity yet? What if you have chronic infections that need to be dealt with? What if you have a mold exposure that needs to be dealt with? What if you have some unique genetic variations that require you to have a lot of folate and fix things? And we can do the lab testing. We can do a lot of things to help sort all that out.
Super useful. Thank you. Just to kind of wrap up here, I mean, I think what I'm starting to believe is that and see in sort of real life people is that the earlier we get to people, probably like heart disease, the more it seems like we can do. So the earlier you can get to somebody when they start having thinking or brain or issues, and it becomes an okay thing to talk about in a doctor's office. And of course, there's all types of issues with insurance and long-term care insurance. And if there's even mention of a memory issue after age 45 and it's not ADD, et cetera, it's a complicated issue. I think we all understand that. But any strategies on continuing to get the word out on prevention? Part of it is just people caring, but in terms of social media, networking, what do you think are the most effective strategies, kind of being an expert in this, of getting the word out on the earlier you detect, the earlier there's something to do?
I think most people feel like there's nothing to do with Alzheimer's. It's like roulette. You hope you don't get it and you hope your number doesn't come up. But there's actually a lot you can do. And I think raising awareness around that, through all the methods you talked about, I'm doing a documentary on the brain through which we're going to see tremendous, I think, impact that looks at all the experts in this field. What they're doing is pretty exciting about prevention, and even early treatment can reverse it. So podcasts like yours, looking at key thought leaders and following their work, people like Max Lugavere and Dale Bredesen and David Perlmutter, and you are out there doing these things. And I think that's really a very powerful model for spreading the word, because it's not coming, unfortunately, from the halls of academia or major medical institutions.
Well, that's to be determined, right? We're working on it.
We're trying to change that, right, Nate?
Right. So what is your documentary called, and when do you anticipate it will be coming out?
It's called Broken Brain, and we're going to probably have it out in the summer, early fall.
Oh, wow. That's so exciting. I look forward to it. Mark, thank you so much for making the time to talk to us. I really appreciate it.
Of course, Nate. My pleasure.
So that's our episode. I hope you guys got something out of that. Check the show notes out on iTunes or on our website, where we've summarized the key points. If you have questions or comments or just want to connect, please check us out on our Facebook page. Or if you're old-fashioned like me, Google Evolving Past Alzheimer's Podcast, and you'll find us that way. Finally, if you find the information here valuable, please consider giving us a 5-star rating on iTunes and leaving comments in the comments section. It will really help us bring this message to as many people as we can. Thanks, and talk to you next time.